Assalamualaikum warahmatullahi wabarakatuh. Hi everyone! Today I want to demonstrate some basic first aid skills that everyone should know. First aid is very important because accidents can happen anytime and anywhere. If we know how to give first aid, we can help someone before medical help arrives. In this demonstration, I will explain simple first aid treatments. Let's start with the first one. Sometimes people suddenly get a nosebleed. It can happen because of hot weather, dry air, picking the nose too hard, or accidentally hitting the nose. If someone has nosebleed, don't panic. Here are the steps to treat it. First, ask the person to sit down and stay calm. Sitting is better than lying down because it prevents blood from flowing into the throat. Second, ask the person to turn their head slightly forward. Do not tilt the lead backward because the blood can go into the throat and cause choking. Third, use your finger to gently pinch the soft part of the nose. This. Hold it for about 10 minutes. This pressure helps stop the bleeding, like this. While pinching the nose, the person should breathe through the mouth and stay relaxed. 4. If possible, you can place cold compress or ice pack on the nose or the back of the neck. The cold temperatures help slow down the bleeding. After 10 minutes, slowly release the nose and check if the bleeding has stopped. If the nose is still bleeding, repeat the process for another 10 minutes. However, if the bleeding continues for more than 20 minutes, the person should go to the doctor and nurse clinic. That is how to treat a nosebleed. Now, let's move to the second situation. Burns on the hand often happen when someone touches something very hot, like hot water, hot oil, or hot pan. When a burn happens, we must act quickly to reduce the pain and prevent further damage to the skin. First, immediately place the burned hand under cool running water. Let the water run over the burn for about 10 or 20 minutes. This helps cool the skin and reduce pain. Second, remove any rings, watch, to tight items from the hand because the skin may swell. Third, after cooling the burn, gently dry the area with a clean cloth. Fourth, cover the burn with clean bandage of sterile waste to protect it from dirt and infection. It is important to remember what not to do. Do not put ice directly on the burn because it can damage the skin. Do not apply toothpaste, butter, or oil because these can make the burn worse. If the burn is very large, very painful, or has big blisters, the person should seek medical help immediately. That is the proper way to treat a burn on the head. Now, I will explain the third situation. Cuts on the hand are very common. They can happen when using knives, scissors, or sharp objects. If someone gets a cut on their hand, follow these steps. First, wash your hand before helping someone. This helps prevent infection. Second, rinse the wound gently with clean running water to remove dirt or dust. Third, if the wound is bleeding, use a clean cloth or sterile gauze and press gently on the wound for a few minutes. These pressures help stop the bleeding. Fourth, once the bleeding has stopped, clean the wound carefully. Fifth, Apply a small amount or antiseptic if available. This helps prevent infection. Finally, cover the wound with bandage or plaster to protect it. The bandage should change every day to keep the wound clean. However, if the wound is very deep, very large, keep bleeding, the person should go to a doctor to proper treatment. This is how we treat a cut on the hand. In conclusion, knowing basic first aid can help us respond quickly during small accidents. Today, we learned simple first aid treatments, how to treat nosebleed, how to treat a burn on the hand, how to treat a cut on the tree. This simple step can help reduce pain and prevent more serious injuries. Remember, staying calm and acting quickly is very important in first aid situation. Thank you for your attention. Have a good day. Bye.